All right, and thanks for joining us as we begin a new week and consider the challenges that lie ahead. Welcome to members of the media and those of us who are joining us online. Today, Orange County Mayor Demings will discuss our positive cases, our percentages, our goals for the week, and some details of movement over at our convention center. Orlando Mayor Buddy Dyer will also discuss what is taking place in the city of Orlando. Dr. Raul Pino from the Florida Department of Health in Orange County has information on our testing numbers, positivity rates, time frames, and other important data. We start this dialogue today with Mayor Demings. Mayor?
All right. Good afternoon to all of you. Thank you for being here once again. Wanted to just start by just kind of reiterating some of the things that have happened over the last nearly 5 months now. We have been in a state of emergency with our Emergency Operations Center active for over 125 days now. And that had never happened in the history of Orange County to have an activation for that period of time. But also, during these nearly 5 months, our healthcare workers have really been serving on the front lines, and I'm certain that fatigue has set in for many of them, but we do appreciate the work that our healthcare workers are doing while we continue to figure out how to live with this virus amongst us. So as we kind of look with this week approaching now, there are a number of things that I want to talk about. Each week that we go forward, I try to, at the beginning of the week, talk about the goals for the week. And so we have multiple goals. Of course, this week here within Orange County, our goal is to increase community testing. Number 2 is to continue to distribute crisis assistance funds as well as PPE to individuals, families, and small businesses, and I'll talk about that more today. And lastly, to closely monitor the COVID-19 numbers and hospitalizations. There are 2 critical factors that we will look at to make public policy decisions. Number 1, the new positive cases that occur within our community and the associated positivity rate, and perhaps more importantly is the hospitalizations. If we continue to see the numbers go up, I don't want to get to the point where we approach capacity within our hospitals. That would be catastrophic for us as a community. And so we're going to be decisive in making decisions going forward related to those 2 particular issues. There was another increase in COVID-19 deaths over the weekend. Orange County now has 83 people who have died as a result of the coronavirus. I want to talk about the next 4 days. You know, each 14-day cycle becomes a critical period of time. And if you think about July the 3rd, the beginning of the Independence Day weekend, this coming Friday would have been 2 weeks since that period of time. And so between now and the next 4 days, the numbers that we will review and evaluate will set the stage for some additional decision-making points for us as a community. The latest numbers show a total of 18,937 cases were reported in Orange County. So nearly 19,000 cases have been reported of positive incidents here within our county alone. Within the last 24 hours, nearly 1,000 new cases, 936 to be exact, is the number that came in today. On Sunday, we had a record-breaking 1,371 new cases reported. These numbers, quite frankly, are not good for us as a community. It sends a bit of an alarm to us, so we must look at the numbers carefully. Dr. Pino, our health officer here in Orange County, is going to talk more about the specific numbers in just a few moments. We have tested over 185,000 individuals, and our overall positivity rate has now increased to 10.2%. Our goal has been to keep that number below 10%. But as cases rise, we know that we have some challenges for us. The rise of cases in our region could lead to a potential shortage of hospital beds. And I have been in continuous conversation with our healthcare executives here in the area, and they have reassured me that at this point, we're fairly safe. We have not exceeded capacity within our hospitals. However, to that end, the Orange County Convention Center has been visited for the past 2 days by the Army Corps of Engineers with the outreach that we made some time ago to the state of Florida looking for long-term plans. I suggested to them that the Orange County Convention Center could be a potential site as an alternate medical treatment site, and they have been evaluating our convention center for that. If we would need to do that, that would only happen if we exceed here within the region our hospital bed capacity. If we are chosen, the convention center would be a site for as many as 500 beds for Orange, Osceola, Seminole, and Lake counties. So that's a contingency plan that we're looking at putting in place. Also, due to the alarming numbers, the Business Compliance and Consumer Confidence Working Group will convene to discuss solutions to help slow the spread and get more businesses to comply with facial covering executive orders. The meeting will be held virtually tomorrow afternoon from 3:30 p.m. to 4:30 p.m. It will be broadcast live on Orange TV, and you can go again to ocfl.net/Orange TV in order to view that. We have been getting a number of emails and phone calls regarding the potential for the schools to reopen here within Orange County. I will tell you that at this point, that is a decision that the school board is taking under consideration. As you all know, tomorrow they will make a decision about whether or not to move forward with their reopening plans. It is something that we're monitoring. You know, we have the 8th largest school district in the nation, the 4th largest in the state of Florida, with 215,000 students in 199 different schools. So we're a large school district. And I'm certain after conversations that I had this morning with the school superintendent, Dr. Jenkins, that the underlying goal that they have is to open the schools safely for both the students, faculty, and others who will be visiting the schools. If they can't open it safely, then they won't open it. So we'll pay close attention to that in the coming days. Now let me talk a little bit about testing. We have increased testing this week. Orange County Health Services will be providing testing at Barnett Park in West Orlando between the hours of 8 a.m. and 1 p.m. For the remainder of this week. They anticipate approximately 500 people being tested for COVID-19 each day. It is best to go online and make an appointment in advance, and what they have shared with me today is that we are booked through Wednesday. So look to the latter part of the week if you really want to get tested at the Barnett location. It is best to make appointments so that you don't have to wait in long lines. We'll also be doing testing at Barnett Park next week, and appointments will be made for that as well. And you can sign up for tests at ocfl.net/coronavirus. This morning at 8 a.m., the online application portal opened for the CARES Act money for individuals and families, and we reached our goal of having 10,000 people apply within just under 11 minutes. So we closed the portal down. This is the 5th time Orange County has opened the portal for individuals and families since early June. I will tell you that 109,000 people have visited our website over time seeking information about the crisis assistance. Counting today's applications for individuals and families, we have had a total of 37,800 applications submitted, and 21,000 of them, or about 86% of all applications, have been approved. That equates to about $21 million approved for payments in increments of $1,000 to individuals and families. So far, the comptroller has actually mailed out checks or cut checks for about $7.5 million, including another $920,000 that was submitted today alone. So we're moving along at a fairly quick pace. As far as the future portal openings, we need to process the latest applications before we decide if we want to reopen it again. We have a finite amount of money that we have to administer. We do have the plan administrator that's here today, so if you have specific questions about what we're doing with the crisis assistance for families, then she's here to help answer those questions. In terms of the small business grant program, we continue to accept applications daily for that program. A little more than $21 million has been approved for payments to small businesses with a total of 7,254 applications. Now I'll talk a little bit about sandbags. We have already had our 6th named storm of the 2020 hurricane season. It serves as a reminder that the peak of hurricane season is coming. Starting Thursday and running through the end of the month, we are offering free sandbags at 5 Orange County Park locations. These sandbags will have to be filled by the participants on site. We encourage everyone to wear face coverings and bring your own shovel to fill the sandbags. In addition to the free self-serve sandbags, we will be giving out free face masks and hand sanitizer to each of the households that will be participating in that program. To get more information on the hurricane preparedness, you can visit our website at ocfl.net/storm. On Wednesday, our MLK initiative will be holding another virtual town hall meeting to get our teens and young adults involved in an important community discussion. The town hall is called Candid Conversations with Our Community, the Generation Z edition. It will run for 90 minutes from 6 p.m. until 7:30 p.m. The goal is to engage the younger generation on such topics as bias, discrimination, and injustice. We are hopeful that by having this kind of discussion, we will inspire and get our youth involved. The focus will be on teenagers to about 25 years old. To get information, you can go to our website also at ocfl.net/candid conversations. Again, we ask that you tune in to watch us on Wednesday for that lively conversation. Today, I brought a Lynx face mask to wear as a reminder that everyone that boards our Lynx buses will be required to wear face coverings. And so we walked in with it, and you'll see me don it in just a few moments again. The Lynx staff is handing out free masks at select transfer locations throughout the region. And right now the team is at the Washington Shores location, and tomorrow at 6 a.m. they will be in Apopka. We can also visit the Lynx customer service window to pick up a free mask. Again, for more information about what Lynx is doing, you can go to golynx.com/coronavirus information. And so I know that's a lot of information I just shared with you. And this time I'm going to ask Orlando Mayor Buddy Dyer to come forward and share information as well.
Thank you, Mayor Demings. As we continue to go out for essential services and support our local businesses safely during phase 2 reopening, we have to remember to be hyper conscious about our behaviors and being disciplined with them. The discipline of being a good citizen, doing whatever you can to help not only yourself, but your family members, your neighbors, your out frontline workers, our local businesses, our healthcare workers, means that your individual actions can help further and stop slow the spread of the virus here in our city. Mayor Demings mentioned earlier that in addition to the drivers and staff at Lynx, those passengers that are riding Lynx also have to wear masks. So I support their efforts in keeping not only the limo drivers safe, but your fellow passengers safe by wearing a Lynx face mask. Each one of us has to continue to step up and take steps to save lives. We all want the virus to go away. I certainly do, but what we can't do is ignore the fact that it is still here, and we can't pretend that it's simply gone away. I've seen people in South Florida talking about having COVID parties. I can't think of anything more ridiculous than that. We don't know what the effects of this virus is. We don't know that even if the asymptomatic people think that they're healthy and okay, we don't know what this virus is doing long-term to their organs and their bodies. So if you think you're safe just because you aren't showing symptoms and you think, oh, it's okay if I go ahead and have the virus, irrespective of the fact that you may have people in your life that if they get the illness, they could die. We need to stay safe and we need to stay strong. We need to wear a mask. We need to keep our distances and we need to wash our hands because this fight is unfortunately going to be a long one. I know it's emotionally hard for everybody to keep fighting this virus. There are people worrying about paying their bills, putting food on the table, being away from friends and family, having to socially distance, and not being able to simply get back to normal routine. And I know I've been stressed, I'll admit that. Feelings of isolation and anxiety are certainly with a lot of people. And that's why it's important, in addition to practicing good hygiene, we need to practice good mental health and well-being habits. Get outside and get fresh air. Try exercising. Cook a healthy meal from scratch. There's probably some people around here who haven't done that in a while. Do some yoga, stretch, even try some meditation. And I can't tell you how important it is right now to take care of yourselves during this challenging time. And if you need somebody to talk to, if you need some help, reach out to Heart of Florida United Way's 211 service. They're here for you. You can get connected to support programs that include food, financial resources, mental health assistance, utility assistance. So much has changed, as Mayor Demings said, since we were first impacted by the COVID virus here in the U.S. and Central Florida. But what hasn't changed is the role that we each can play in stopping the spread. So Orlando, we must remain united in our efforts. We must stay strong and diligent. We must mask up. We must keep our distance, and we must continue to wash our hands and sanitize regularly. If we don't do these things, then we let the virus take control. But if we do these things, then we take control. Dr. Pina?
Thank you, Mayor. Before I go into the COVID data, I would like to read a statement from the Florida Department of Health with regard to school openings. Florida Department of Education Order 2020, Executive Order -06, give authority over the decision of whether to open schools and how to open schools to the local school board and the school superintendent. The local community health department does not have the authority to determine when or how students will be returning to schools. The county health department works in collaboration with the local school board to provide county data and trends and educate on mitigation strategies to make the school's environment as safe as possible. That is the statement. With regard to the testing, the mayor mentioned that we have reached 18,937 positive cases for a cumulative positivity percent of 10.2. We also has a number of fatalities added to our list. We are up to 83. The general statement on that is that those are between the ages of 48 to 77 with underlying conditions that were cardiovascular disease, chronic obstructive COPD, obesity, and hypertension. We are not going to go case by case, although the list is extensive this time. It will take a lot of time. We also want to see some trends in the data that are out there. So today we got reported for the 12th, that's yesterday, 7,689 negative tests with 924 positive. That's a 10.7 percentage. And the day before, Sunday, well, that will be Saturday data, we got reported 12,134 negative tests and 1,353 tests. That is for a 10% positivity rate. Friday, we got 3,446 negative cases and 476 positive cases for a 12.1. So it's evidently that it's a big jump in the number of tests performed in the county. There could be several factors, or those, although we continue to dig in the data and try to find an answer to some of the questions that we have. And we are having a conversation with the state with regard to this number. Part of it, and we don't know that yet, could be that the state has increased an effort to increase the number of labs that are reporting electronically. So that will increase the number immediately. As labs become online, the data gets to us earlier. Some labs have continued to report by fax, so that's a data that was entered at a later time. So that could be one of the issues. The other issue in the high number of cases reported to us could be that there was some batching. You know, there was some delay in reporting during the week and the prior week, so it could be an accumulation of cases that were reported all in one day. Normally, the labs will inform us when that's going to happen. We are exploring because we don't have that information. And the other factor is the MBA testing and the MLS testing, which are testing very often, is counting in the county because they are here right now. So we are looking for a solution, if it's technically feasible and possible, to segregate those two data, the one for our general population in the county and the one data for what is happening in Disney, in the bubble for MLS and NBA. But that could be very difficult if the labs that they are using are also being used for by other entities, because then that will cross a mismatch cases and they will not come in a block. So with that, when we get more clarification in the data, and if the data change, we will let you know. Also, we have seen in the week that ended the 5th, we saw a decrease in ER visit for syndromic, influenza-like illness, and COVID-like illness. Although we continue to see a number of cases going to the ER that has increased for fever, shortness of breath, and cough. So we have two ways to measure these. We measure the individual symptoms that people present with, in case that someone presents with one symptom, just one. And then we also measure what we call influenza-like or COVID-like, meaning a person that is presented with all the symptoms at once. And those are counted a little bit different because it gives you a better idea. For those who have all the symptoms at once, we have seen a decline for flu and for COVID-like syndrome. Also, we have seen a decrease in the number of cases that are between 20 and 40 in the last 14 days. Remember, we have explained this to you often. Now it is about 47% of the total number of cases, and it used to be over 50%. So that is an indication that the pandemic may be moving into the older segment of the population. We also have seen a small decrease in the incidence per 100,000 in our residents. The week number 26, we were at 345.3 residents per 100,000 with the disease. And last week, we ended up at 272.8 residents per 100,000 with the disease. This week so far, we are 273. I also, in the total number of cases, the week that ended last, That was week 27. We saw a total decrease of the number of cases by 21%. And that is from the prior week 25th. In week 26, we have 4,741 cases. That was an increase of 142% with respect to the prior week. And week 27, the week that just ended, we had 3,748 cases for a 21% decrease. Now, how these pair with what the mayor was saying with the high number of single-day cases that we are receiving. These are days of this week. So that could change the entire dynamic for the week that we are right now if we continue to have those numbers. And those are serious numbers, and we have to look in the general context of the data. With that, I will pass it to Mayor Demings and will answer any questions that you may have.
Okay, we'll open it up for questions, and just as a reminder, if we have Spanish-speaking media that's here, if you have a question in Spanish, feel free to ask it while the press event is going on. If the question is of me, I will ask Ms. Ilia Torres to come forward and translate for me, and if it's for Dr. Pino, he's fluent in English and Spanish. So.
Mayor Lauren Seabrook, Channel 9. You kind of alluded to possibly looking at some changes that could be coming depending on what the next 4 days say. I know at one point I had asked you at what point you might consider further shutdowns, and you mentioned when that positivity rate got into double digits and being at 10% now. Just asking what your thoughts are on possibly shutting down again or limited shutdown again, or what you are considering if the numbers continue to be bad.
I don't think we're at the point yet to roll back the reopening, but if we get there, not just the positivity rate, but again, the hospitalizations and the capacity there becomes very important to any decisions going forward. If those numbers continue to escalate, then obviously we'll have to make some adjustments there, and it could mean consulting with the governor. There's an executive order that the governor has out now, and it somewhat restricts local governments for putting in place restrictions that are more stricter than those codified in the governor's order. Having said that, however, though, we have to be fluid and adjust to the environment that we find ourselves in. And I will explore that if necessary, if we are able to track outbreaks to any particular types of businesses, then we will address that through the emergency orders and through the established processes. If we see where a number of businesses remain closed, if you will, if there's any concern for the safety and security of property, we may have to go back and look at the reinstitution of curfews within our community. If we didn't see people widely wearing masks, I would revisit the potential for having penalties associated with failures to wear masks. So those are all things that if the virus continues to rage at a level that begins to significantly impact us in the ways I enumerated, then we'll have to make some adjustments at that point. But I'm happy to say that given the theme parks that had opened prior to Disney, we have not been able to see any type of outbreak specifically associated with any of those parks. So for me, if there's one place on planet Earth where we should be successful, it would be at Disney. Disney has gone through great lengths to look at all of their various safety and sanitary protocols, and they have instituted proper measures. As it relates to the professional athletes who are playing on site at Disney, they're probably, because they're in isolation, pretty much they're not leaving, and very few people are coming into that environment. it's somewhat of a bubble that they're living within. So comparatively speaking to the general population, is probably as much secure at Disney in terms of the protection against the virus than being out in the general population. And so I think that bodes well for the athletes who are playing there. They are being tested very frequently. You heard Dr. Pino talk about that a few moments ago. So all of this within this week, we're going to be looking at very carefully.
Danielle Lama with Fox 35. This question's for Dr. Pino. So we know that the state has mandated that all schools reopen in August. If a student or staff member tests positive at school and you have to test an entire class or whoever they've had exposure to, will the state health department assist with that testing in the contact tracing, or will families have to find testing on their own if that happens?
No, we will. The health department will. We are working with the board and the superintendent, and they are elaborating a plan that we hope to see soon. And I have a call actually from the superintendent that I have to respond today. I haven't been able to. So we will be assisting with testing. And the state is going to send guidance for us in how to assess in those situations. But that's why we have insisted to the board that students and teachers should be kept in a cohort so that it's easier to do that type of work, and even to isolate a cohort if you need to protect the larger population from contracting, if that's the case.
Eric Sandoval with Channel 6. This question is for you again, Dr. Pino. You made mention that some of the new positive cases are moving to the older residents here. For weeks we've been talking about the positivity basically hitting the 20-somethings. Do you think this is a result of the family situations, the multi-generational family situations, or is it something else?
I think it's a little bit of everything. I think the closing of the bars may have played a role in decreasing transmission among younger population. That's what we identify some of the cases. Not every case, but many cases in those areas. And we are looking into more indoor environments now that we know that the virus can be transmitted indoor environments quite easily if people are not wearing masks. And that's why they are recommended in all circumstances. So as we determine what places things are happening, we will continue to do more surgical approaches to it. The issue when you have community distribution like we have right now is that it's very difficult to pinpoint. It becomes harder and harder to pinpoint what a person may have acquired, especially if they have a lot of mobility. At the beginning, it was a lot easier because the bars were open, it was a place that everyone went to, and we can trace it in families and friends. When you have community distribution and someone went to the supermarket, to the pharmacy, to the school, to the doctor, then, where you catch it is the question.
Dr. Pino, Asher Rahman, Channel 13. Just Sunday with the 15,000 cases that were reported, just for you, what can you attribute to, is there a backlog in when these results are being considered? It's a large number, and if people are wearing masks, 4th of July bars were closed. Just why is there such a large number, and can you explain maybe, is it concerning?
I don't know the answer. I have theories. What I mentioned to you, part of the issue is, if you see Saturday and Sunday, and Saturday you have 12,000 cases, on Sunday you have 7,000. So there is a difference there that make account for batching, because our testing should be consistent through the week. It varies a little bit, but not that much. So that jump is what caught our attention right away, and our APs are digging into the data to see if they can find some reason why this happened. So far, we haven't been able. But we think it's a combination of new labs coming online and reporting electronically. We think that it's a combination of batch data from delay in testing in prior weeks. And also, we think that the NBA data is starting to be reported to the county. So we think because if the NBA and the MLS data is start being reporting electronically, then that makes sense for the high number of cases, as they have thousands of people that they are testing daily and sometimes twice a day. But those tests will come like just once. I did. No, not confirmed yet. When it gets confirmed, is that we have solid evidence. We only have theories right now.
Sonica Donge, West 2 News. My question's either for you, Dr. Pino, or Mayor Demings. You mentioned contact tracing is not showing that there's outbreaks at any of our theme parks, but what is contact tracing telling you about where most of these cases are being contracted?
So most of the cases are community acquired, means out there, where you, again, cannot pinpoint where a person was last before they acquired symptoms, or if they knew that they were exposed to someone positive. So those are trends in the community, and as it becomes larger and larger or more community widespread, it is more difficult to pinpoint where people are acquiring. We actually don't have, right now that I know, larger outbreaks going on. So we have a lot of community distribution. We have been able to curtail some of the outbreak with the strike teams that we have done testing specifically in outbreaks, and that's the same approach that perhaps we are going to use for the schools if we need to. Well, I don't know the reason why people are getting tested. What we see in the data is your question was where people are more often acquiring the virus. And the answer for that question is they are acquiring the virus in the community most often.
Rafael Carderera from Telemundo. This question is for Dr. Pino in Spanish. Thank you, Dr. Pino. Doctor, ¿qué tan lejos cree usted que estemos de llegar a ver a los hospitales abarrotados de gente, y cuál sería el plan de contingencia en caso de llegar a esto?
So the question in Spanish was how far are we from seeing the hospitals overwhelmed with cases, and what are the contingency plans that we have for that situation? En español, no sé, mira, ellos, los hospitales tienen la capacidad de añadir camas, porque tienen espacios muy flexibles. Y en estos momentos, o en la mañana, cuando yo miré la base de datos, teníamos más de 1,000 camas disponibles en el condado. Entonces, hay varios pasos que ellos siguen. El primer paso es parar los procederes electivos. Es decir, la gente que no tiene una emergencia, paran eso. Y empiezan a mandar a la casa a las personas que están esperando cirugía o las personas que ya completaron el proceso. Eso te eleva el número de camas inmediatamente. El otro paso que ellos tienen es añadir camas. Y el otro paso, entonces, con el Estado, poner lo que se llama un sitio de cuidado alternativo, en el cual el centro de convenciones o el Amberway Center o un lugar grande como esto se hace un hospital, se convierte en un hospital con camas adicionales. También otro paso que podemos tomar es sacar las personas que ya pasaron la fase más crítica del virus y ponerlos a recuperarse en un lugar diferente a un hospital para aliviar esas camas. Estamos lejos de que eso suceda. No creo que en el futuro inmediato nos vaya a suceder este tipo de situación. So the answer in English to the question, how far are we from overwhelming the hospital, and what are the steps that the hospitals will take before getting to that point? So I don't think that we are any close to overwhelm the hospitals. Our bed inventory is healthy right now. We had this morning about 1,000 beds in the county available, and about 100 of ICU beds available. So the hospital also have the ability to increase beds, and because they have very flexible spaces. And there are other measures that they can take to increase the number of beds. Among those is suspending elective procedures that will add beds immediately. The other step is to discharged individuals that have recovered, but they are just in recovery phase or in isolation to a facility different than the hospital. And we can also, with the support of the state, create an alternative care site in either the convention center, the Amway Center, or a larger space where we can add beds, or even in some cases you can add a field hospital. But I think that we are far from there. The mayor is in constant communication with the officers, chief operating officers at both systems. And we had a conversation today. We had one last week. And they continue to assess that they have a healthy inventory. They have the materials and PPE that they need. Where they have areas of concerns in staffing. Staffing is always the issue because you need to rotate staff, you need to give them a break. And ICU care requires a special staff that requires years of training. So those are the points. Thank you.
This next question was texted in for you, Dr. Pino, from Nassim Miller with Orlando Sentinel. On Friday, the Agency for Healthcare Administration began reporting current hospitalization data. Do you know which patients are included in this data? Is it only patients with primary diagnosis or all patients in the hospitals with COVID? If it's only patients with primary diagnosis, does it mean patients with secondary COVID diagnosis are less resource intensive at hospitals?
So that's a complicated question. I don't know the answer. I haven't desegregated the data that way, and I don't think that we have the ability to segregate the data that way, desegregate the data that way. But the data that we get being provided, and I didn't provide it today, but I have it right there. I will provide it when I have a chance, is that everyone who has a COVID diagnosis in the ICD-10 code that was developed for COVID-19. That's how it's reported.
And this next one is for you as well, Dr. Pino, from Nikki Zizaza with WKMG. A petition is circulating requesting that you, Dr. Pino, recommend OCPS remain closed until the threshold is met to enter into phase 2 as outlined by the CDC. Will you make that recommendation, and if not, why?
So I will not be making any recommendations to the board. I will be presenting the data as I did last week, and they have to make that decision. Now, when the time comes and they present the plan, I may have suggestions, I may have concerns, and I may have expressed those concerns to them when that point comes. But that will be their decision.
This next one is for you, Dr. Pino, as well. Kelsey Thurr texted in. Last week, you discussed working with the state to try and set up an area where people can go quarantine if they don't have anywhere else to go. Is there any update on that? And how many people are currently self-isolating in the hospitals?
Well, people in the hospitals will not be self-isolating. Self-isolating, as a definition, is at home, not in the hospital. So the question is, how many people are in the hospital that can be discharged because they are in better shape? I think that was the question, probably. And I don't know the number. Last time that the hospital gave us a number was close to 100 between the two systems, but that could have changed. We did have a conversation this morning. The mayor initiated that conversation and kindly invited me to be part of it. There are several issues. First, there are individuals in the hospital that don't want to be discharged because they don't want to go home because they are other family members. So that is a concern in the saying. I expressed it this morning because there are many people at home with positive cases. It's happening, it's out there in the community. What we have to learn is how to protect ourselves and protect our family members. So the fact that we are keeping beds occupied with people that can be discharged in a situation like this is, it's a counterpoint. The other thing that's happening is that assisted living facilities have transported to the hospital people that have been diagnosed. And in some cases, assisted living facilities don't have the infrastructure to isolate individuals within the confinements of the facility itself. So that's a conversation that we have with ACA and with the Surgeon General this afternoon. And the mayor and others and us together are looking for the possibility of using hotel rooms as a place to isolate and for recovery. But it have to be people that are self-independent, that they are not needing oxygen, they are not needing suction. So there are complicated answers that before we move anyone, we have to answer.
This next one is from Steve Hudak with the Orlando Sentinel. Dr. Pino, what can you tell us about the inclusion of the Orlando Immunology Center in a COVID-19 vaccine trial? What does this mean for our community?
So I'm having a conversation with them this week. I believe, and I have limited information because I haven't talked to the Immunology Center, that they are in the clinical trials for one vaccine, for one candidate, and another one or another two to be approved. And Miami-Dade is in a different vaccine also. There are several. There are hundreds of vaccine candidates getting different phases around the world. And we have been selected for, I believe, one of those and possibly another two. The health department is going to talk to them this week to encourage how can we participate, be part of it. They approach us, and we are happy to participate.
And this last one for you, Dr. Pino, comes from Ingrid Cotto with El Sentinel, and she would like this in Spanish. Her question is, many people have asked us why the testing sites are asking for a government issue ID. We know that it has been explained that testing has nothing to do with immigration status, but the fact that a government issue ID is being asked, some people have expressed concern and have said that they are afraid to go and get tested. Again, she'd like this in Spanish.
So la pregunta en español fue ¿por qué el... You don't speak Spanish? No. The question, that was a joke, I know that. The question was in English, the question was why are the testing sites requiring, en Spanish, ¿por qué los centros de hacer pruebas están pidiendo documentación del gobierno? Entonces, los centros tienen la necesidad de saber a quién le están haciendo la prueba. Y en algunos casos la tecnología requiere de un documento donde le tomas una foto y hace toda la entrada de la base de datos para la prueba. Porque los laboratorios, imagínate, hay cientos y cientos, miles y miles de pruebas que se están haciendo al día. Se necesita saber a quién pertenece la prueba por una manera de hacer el matching. Entonces, the answer to that question is that some form of ID is needed not to prove that you are legally or not in the country, but to know that you are the person you say you are, or at least that you have a documentation. Who are you testing? Because in between thousands of tests, you have to have a way to identify that testing, either by birthdate. We don't use Social Security, but we use name, birthday, address, and zip code. And that has to be also how the test result is assigned to which municipality when you get the results back. So there have to be some form of ID.
Thank you. These last few are for you, Mayor Demings. This one comes from Eric Von Aiken with WKMG. What advice is the county offering travelers from the New York area who come to Orange County, parentheses, Disney, who are still quarantined or still required to self-quarantine for 14 days under the governor's existing executive order? These visitors are conflicted, as you probably can imagine.
My advice to them is to follow the governor's executive order. I think as we move forward with the reopening of the theme parks, the governor may make some adjustments in his executive order.
This next one comes from Steve Mort from WCF Newsnight. Mayor, Hong Kong Disney closed today after the region reported 52 new cases. Disney says it will follow the directions of governments and health authorities. Given that Florida reported 12,000 plus new cases today, will Orange County consider asking Disney World to close?
If we see where, again, the indications would be that we are exceeding our hospital capacity, and if there are any outbreaks associated with Disney, we won't hesitate to ask Disney to reevaluate the reopening.
And this last one comes from Abe Ibarra from WMFE. Mayor, the executive order, I believe he's referencing, that came down from Governor DeSantis, requires schools to open August for brick and mortar instructions unless there is, quote, state or local health directive to the contrary. So Mayor Demings, what is your interpretation of who can make a local health directive? Can you, as Orange County Mayor, issue a local health directive that would stop schools from reopening in person?
The interpretation of the governor or the Commissioner of Education's emergency order by our legal is that the authority rests with the school district in consultation with the local health officer. And the local health officer is Dr. Pino, who is actually a Florida Department of Health employee. He just happens to be assigned here to Orange County. And so the decision is really that of the school districts, unless there was some overriding local ordinance that restricted business or commerce or movement within the community. It falls within their purview. And so tomorrow at the school board meeting, they will make a decision based upon the input that they receive from experts like Dr. Pino and others. They still have the burden to follow the emergency order and to be able to accomplish the reopening in a safe manner, given the guidelines that they were provided. Can we have one more? That's it? Okay. If there are no other questions, Commissioner Gomez Cordero is here. She's another bilingual individual. If the local Spanish stations were interested in doing one-on-ones, any of our Spanish speakers are here. So thank you all for joining us. Hopefully this has been informative to you.